Dear viewers, greetings. In this present video, we are going to see about the bacterium Pseudomonas aeruginosa. First, general characteristics of Pseudomonas aeruginosa. The bacterium Pseudomonas aeruginosa is a gram-negative rod-shaped bacilli, and it is motile in nature due to the presence of single polar flagellum. And its size is 1 to 5 micrometer long and 0.5 to 1 micrometer wide. It belongs to the family Pseudomonaceae, and capsules are occasionally present, endospores absent, and the mode of respiration is aerobic respiration. Regarding the optimum temperature, the optimum temperature required for the cultivation of Pseudomonas aeruginosa is 37 degrees Celsius. Optimum pH is 7.5 to 8.5. Regarding the habitat, Pseudomonas bacteria can be found in soil, marshes, coastal marine habits, and plants and animal tissues. And generally, these bacteria can tolerate a variety of physical conditions. Pseudomonas aeruginosa are opportunistic pathogen. It is also referred as an important pathogen for causing nosocomial infection. Regarding the discovery, Pseudomonas aeruginosa was discovered by the French bacteriologist Karl Gezard in 1882, and he identified that its water-soluble pigments turned blue-green when exposed to the ultraviolet light. Disease transmission of Pseudomonas aeruginosa. Transmission of Pseudomonas aeruginosa occurs from patient to patient on the hands of healthcare workers, by patients' contact with contaminated reservoirs, and by the ingestion of contaminated materials. Virulence factors of Pseudomonas aeruginosa. The ability of the microorganisms to cause the disease is called as virulence. The term virulence was first coined by the scientist Louis Pasteur. And the virulence factors are the factors which are responsible for causing an infection in human beings. And here Pseudomonas aeruginosa have 4 virulence factors. They are adhesins, toxins, pigments, and enzymes. The first virulence factor of Pseudomonas aeruginosa is adhesins. Adhesins includes flagella, which mediates motility, pili, which mediates adhesion, lipopolysaccharides, which possess endotoxin activity, and finally alginate. Alginate are the mucoid exopolysaccharides that forms a prominent capsule on the bacterial surface and protects the organism from phagocytosis and antibiotic killing. The second virulence factor of Pseudomonas aeruginosa is toxin, and here the exotoxin A disturbs the protein synthesis in the eukaryotic cell or human beings. The third virulence factor of Pseudomonas aeruginosa is pigments. It includes 2 pigments. The first pigment is pyocyanin or blue pigment, and the second pigment is pyoverdin or yellow-green pigment. Pyocyanin or blue pigment catalyzes the production of superoxide and hydrogen peroxide, which are the toxic form of oxygen. This pigment also stimulates the interleukin 8 release, leading to enhanced attraction of neutrophils. And next, the pyoverdin or yellow-green pigment. It is a siderophore that binds iron for use in metabolism. This pigment also regulates the secretion of other virulence factors, including the exotoxin A. The final and fourth virulence factor of Pseudomonas aeruginosa is enzymes. It includes elastase, alkaline protease, phospholipase C, and exoenzymes. Elastase or serine protease and zinc metalloprotease degrade the elastin, resulting in the damage of elastin containing tissues and producing the lung parenchymal damage and hemorrhagic lesions. The hemorrhagic lesions are associated with disseminated Pseudomonas aeruginosa infections. And next, the alkaline protease enzyme is involved in tissue destruction, and the phospholipase C is a heat labile hemolysin that breaks down the lipids and lecithin and facilitating the tissue destruction. And finally, exoenzymes. Exoenzymes targets the eukaryotic cells and it results in the epithelial cell damage, facilitating bacterial spread, tissue invasion and necrosis or tissue damage. An incubation period of Pseudomonas aeruginosa infection is 2 days and the infected dose required to cause an infection is 1000 CFU per ml. Pathogenesis of Pseudomonas aeruginosa. Pseudomonas aeruginosa is an opportunistic pathogen. It rarely causes disease in the healthy persons. In most cases of infection, the integrity of physical barrier to infections like skin or mucous membrane is lost or an underlying immune deficiency is present. Pseudomonas aeruginosa has minimal nutritional requirement and can tolerate a wide variety of physical conditions. The pathogenesis of Pseudomonas aeruginosa infection is multifactorial and complex. Pseudomonas aeruginosa are both invasive and toxigenic. The three stages of Pseudomonas aeruginosa pathogenicity are bacterial attachment and colonization, local infection, and bloodstream dissemination and systemic disease. The importance of colonization and adherence is most evident when studied in the context of respiratory tract infection in patients with cystic fibrosis and in those that complicate mechanical ventilation. Production of extracellular protease or extracellular proteases adds to the organism's virulence by assisting in bacterial adherence and invasion. Clinical diseases of Pseudomonas aeruginosa. Pseudomonas aeruginosa results in 7 clinical diseases. There are pulmonary infections, primary and soft tissue infections like burn wounds, folliculitis and osteochondritis, urinary tract infection, ear infection, eye infection, bacteremia and endocarditis. The first clinical disease caused by the Pseudomonas aeruginosa is pulmonary infections. Pseudomonas aeruginosa infections of the lower respiratory tract can range in severity from asymptomatic colonization or benign inflammation of the lung bronchitis or tracheobronchitis to severe necrotizing bronchopneumonia or necrosis. Mucoid stains are commonly isolated from these patients and are difficult to eradicate because chronic infection with this bacteria are associated with progressive increase in antibiotic resistance. The mortality rate is as high as 70%. The second clinical disease caused by the Pseudomonas aeruginosa is primary skin and soft tissue infection. And here the first condition is burn wounds. Colonization of a burn wound followed by localized vascular damage, tissue necrosis and ultimately bacteremia is common in patients with severe burns. Wound management with topical antibiotic creams had only limited success in controlling those infections. Folliculitis. Folliculitis resulting from immersion in contaminated water, for example hot tubs, whirlpools and swimming pools. A secondary infection with Pseudomonas aeruginosa also occurs in people who have acne or who depilate their legs, that is the removal of hairs. And finally, Pseudomonas aeruginosa can cause fingernail infection in people whose hands are frequently exposed to water or frequent nail salons. Osteochondritis is the third disease which is coming under the primary skin and soft tissue infection. Osteochondritis is an inflammation of bone and cartilage. Pseudomonas aeruginosa is also the most common cause of osteochondritis of the foot after a penetrating injury that is associated with stepping on a nail. The third clinical disease caused by the Pseudomonas aeruginosa is urinary tract infection. The urinary tract infection is an opportunistic infection. The infection of the urinary tract is seen primarily in patients with long-term indwelling urinary catheters. Urinary catheters are the tubes that collects urine from the bladder. Typically, such patients are treated with multiple course of antibiotics. The fourth clinical infection caused by the Pseudomonas aeruginosa is air infection. External otitis is frequently caused by Pseudomonas aeruginosa with swimming an important risk factor. This localized infection can be managed with topical antibiotics and drying agents. Malignant external otitis is a virulent form of disease seen primarily in persons with diabetes and elderly patients. It can invade the underlying tissues, can damage the cranial nerves and bones, and can be life-threatening. Aggressive antimicrobial and surgical interventions is required for patients with the latter disease, and Pseudomonas aeruginosa is also associated with chronic otitis. The fifth clinical disease caused by the Pseudomonas aeruginosa is eye infections. Eye infections are widely occurs due to the abrasions from contact lenses or scratch on the eye surface. The infection of the eye occurs after initial trauma to the cornea and then exposure to Pseudomonas aeruginosa in contaminated water. Corneal ulcers develop and can progress to rapidly progressive eye-threatening diseases unless prompt treatment is instituted. The sixth clinical disease caused by the Pseudomonas aeruginosa is bacteremia. Bacteremia caused by Pseudomonas aeruginosa is clinically indistinguishable from the other bacteremia caused by the other gram-negative bacteria. However, the mortality rate in affected patient is higher with Pseudomonas aeruginosa bacteremia because of the predilection of the organisms for immunocompromised patients, difficulty in treating antibiotic resistant strains, and the inherent virulence of the Pseudomonas aeruginosa strains. Bacteremia occurs most often in patients with neutropenia, that is low number of neutrophils, diabetes mellitus, extensive burns, and hematologic malignancies. Hematologic malignancies are the forms of cancer that begin in the cells of blood forming tissues such as bone marrow or in the cells of the immune system. Most bacteremias originate from infections of the lower respiratory tract, urinary tract, and skin and soft tissue, particularly burn wound infections. The final and seventh clinical disease caused by the Pseudomonas aeruginosa is endocarditis. The Pseudomonas aeruginosa endocarditis is uncommon and primarily seen in intravenous drug abuses. The patient acquires the infection from the use of the drug paraphernalia contaminated with the waterborne organisms. Lab diagnosis of Pseudomonas aeruginosa. The first diagnostic method is microscopic examination. Under gram staining, Pseudomonas aeruginosa was observed as pink-colored gram-negative rods. In motility test, the Pseudomonas aeruginosa cells are actively motile. Next, colony morphology on culture medium. In nutrient agar, Pseudomonas aeruginosa produces large, opaque, flat colonies with irregular margins and distinctively fruity odor colonies. It shows bluish green coloration due to the production of pyocyanin pigment. It also shows yellowish green coloration due to the production of pyoverdine pigment. In blood agar, Pseudomonas aeruginosa shows beta hemolytic green pigmented colonies. In McConkey agar, Pseudomonas aeruginosa shows non-lactose fermenting colonies. Pseudomonas isolation agar. Pseudomonas isolation agar is used for the isolation of Pseudomonas aeruginosa and other Pseudomonas species. This medium is selective and formulated to enhance formation of blue or blue-green pyocyanin pigment by Pseudomonas aeruginosa. The pigment diffuse into the medium surrounding growth. Biochemical tests for Pseudomonas aeruginosa. Catalase test positive, oxidase test positive, urease test negative, indole test negative, MR test or methylrate test negative, VP test or Voges-Fresca test negative, citrate utilization test positive. In TSI test, Pseudomonas aeruginosa produce alkaline slant, alkaline butt, no gas and no H2S. Nitrate reduction positive, centrimide test positive, gelatin hydrolysis positive, casein hydrolysis negative and starch hydrolysis negative. This image shows the Pseudomonas aeruginosa on TSI test. In TSI agar, Pseudomonas aeruginosa produces alkaline butt, alkaline slant, no H2S production and no gas production. Finally, treatment and prevention. Combined use of effective antibiotics like aminoglycosides and beta-lactam antibiotics is frequently required. Monotherapy is generally ineffective and can select for resistant strains. Hospital infection control efforts should concentrate on preventing contamination of sterile medical equipments and nosocomial transmission. Dear viewers, that's all about the bacterium Pseudomonas aeruginosa. Thank you for your support. Thank you.